Hello.
Hey,
Yes.
blimey.
Hey, Ian. How you doing? You
Hey.
okay?
Look,
Hello.
I got you there, fella.
What are you like? Hey, how are you doing?
I'm very good, very good. I'm so proud of you. I'm so impressed with what you did. It's amazing.
Thank you very much indeed. No, it's down to you, Cesare. It's, if it hadn't have been for you, I wouldn't be here now probably, and it's just fantastic. So
I'm glad that we did a very good things, and you look so well.
thank you. So do you. You've been playing football or?
Yeah, with my son.
Okay, good.
So it's not a big challenge, but it's getting bigger now.
Are you working through the lockdown period or?
Yeah, we've been working very hard because we've been one of the hub in London. There were 2 hospitals that were open. One was Barts, and another one was the Harefield side, that is our sister hospital. So we've been working hard. And we have done over 300 cases over 2.5 months. We have done a lot of cases because all the cardiac surgery was shut.
Yeah.
So,
yeah. Well, one of the things that I said to myself once I had my heart done was one of my challenges was going to be to ride 1,000 kilometers in a month. And I gradually worked up to it until in May, I said, right, I'm going to do this challenge, 25, it was 25 kilometers actually for 25 days. And then Callum decided, well, no, I'll put it down as miles. So I ended up doing 25 miles for 25 days. But sadly, my mum died sort of during that period. And, that sort of set me back a bit. And then I got knocked off my bike a few days later. So I've had a bit of a couple of weeks off, really. And I've just finished it off over the last few days. But I was sort of proud that I was able to do 1,000 kilometers in a month so soon almost after having had, the operation. So
it is impressive.
But Ian, I think I told you, Ian spoke in the Houses of Parliament just before lockdown, didn't you? We had a round table with Baroness Jolly talking about the inequalities of access to treatment and the low numbers of treatment, low levels of awareness, etc., etc. So we invited Ian down, and there was various presidents of the professional societies, and you gave your story, didn't you? It was fun.
Yeah. Good. That was well done, Ian. I like that you are so active. You do so many good things.
Thank you. No, it's
please.
It's just a different life now. I'm so much more able to do things. When about sort of 3-4 months before I had my operation, it was just so bad that I couldn't go out and do much more than about 10K on my bike without being pain, breathless. And then having had it done, there was a period where I had to sort of recover slowly. I was told off a bit because I was doing too much by the primary care people in Frimley Park. Oh, you're working too hard, you're doing too much. So I had to sort of slow down a little bit. I went to the 8 weeks of exercise classes that they do twice a week, just to gradually build my heart strength back up. And once that was out of the way, I'd almost said to myself, okay, I feel all right now. I feel good. I know what my limitations are. I know what my heart rate should be. And I just really worked to that. And it's very rare now that my alarm goes off on my Garmin, for heart rate. I've got it set at something like 140 maximum. And if it gets to 140, the alarm goes off. So I'm keeping it within sort of limitations. My previous life has always been sort of fitness related. I was 24 years in the army. So to be fit was part of my life, and not being able to do it was really hard, to be quite honest. But now, I've got the majority of my fitness, but I wouldn't say I'm 100%. I'm never going to be 100% again, but I'm close as I need to be at my age to be able to do what I want to do.
No, you have to be very strong to do that. You have to be very, very strong to do that, because there are people reacting in different way to an operation. It's a massive step in your life. You realize that you can lose your life, and there are risks. There is a risk of stroke. You can become disabled after an operation. So you have to have a lot of strength to get through as you did.
And how much have you raised, Ian? Have we got a final kind of, I think it was over £700, I think.
I think it's over 800 now.
Over 800.
Yeah. So it went, once I put the day 25 on yesterday, it was going up in 30s, 20s. A 50 came in this morning. I think it's £800 or something like that now. So, but I think that the money's, it's a sort of a byproduct almost. I think the most important part is the awareness aspect. It's making people aware of the potential of what could go wrong if they don't look after themselves properly, if they don't actually assess the risk, that they're going through, pushing themselves too hard. I've talked to there's 290 people in my cycling group, and I put my blogs out to the group occasionally and say, look, these are the things that you just need to be aware of. If you're breathless, if you've got chest pain, just go and get yourself checked. It's worth a visit to the GP or whatever, just get yourself checked. And I put these up occasionally every sort of 6 weeks or so, just to jog people's memory and that. And they're always well received, thanks for that, because the majority of them know me pretty well and they know what I've gone through. So they sort of relate to that in that respect. So,
I don't think I'd be able to keep up with you, Ian, if I'm honest. And I cycle and run around a football pitch. I'm sure I do 25 miles a day.
Well, what I will say is my speed has actually increased since, I started back on my bike last August and it was sort of nice and slow and pedestrian. That I'm back up to about sort of 25, 26 kilometres an hour average now. So I can hang on to most of the youngsters. The speed merchants, they just go and disappear off and down the road. But, most of them I can sort of hang on to. But, yeah.
So while I've got you on, Cesare, I'm going to ask you a minimal invasive question. So have you been doing more of those types of procedures during COVID? Do you think we can lock in that best practice? And do you think we can lock in the evidence so that we can, when the NHS...
Minimal invasive aortic valve. In aortic position, each patient has to be suitable for it. So it depends from the position of the aorta behind the sternum. So if the position is an right, we always do minimal invasive. So we do a smaller cut. If the position, we're not talking about TAVI, we're talking about surgical aortic valve replacement.
Surgical, yeah, absolutely surgical. Yeah, I mean more minimal invasive.
So if the position of the aorta, we saw in the CT scan before the operation, if the position of the aorta is suitable, we go ahead with a minimal invasive procedure.
That's what I've got.
Mitral, the small incision. Yeah. So, and we can decide from J incision or from right anterior thoracotomy. It is cut on the side of the mitral. Yes, again, mitral is something that's is done more at Harefield, on the Harefield campus.
Because I remember speaking to you, Ian, before you even had your procedure, didn't we? The research that you put in. I
did a lot of reading. I spoke to a lot of people about their experiences, people that had been through the process, a lot of which had been sort of via heart valve voice, people who said, speak to Will, go through that loop, because that will really help you. But I also spoke to people who'd, who part of our cycling group as well, who've had the same sort of surgery, but have had mechanical valves. And I took the decision really at the time. I weighed up the pros and cons of each. And I said, well, I'm happy with a tissue valve because I don't want to go through blood thinning agents. I want to think about the future potentially. If I need to have TAVI, then, the mechanical valve doesn't give you that option. So I looked at it in various different ways and I thought, well, that's the way to go. I don't have any problem. I'm quite happy to go out on my bike and do 40 miles, no problem at all, so.
Like you.
In fact, I'm doing it tomorrow. I'll be doing that tomorrow. So.
Are you off out again tomorrow?
I'll be out again tomorrow. Yeah, I've had a day off today. Yeah. well, it's my daughter's birthday tomorrow, so we're on coffee and cake in the afternoon. So I need to go and put a bit in the bank. So.
Right. Well, listen, thank you for your time, Cesare. I know we're a busy week for you. You need to go get some rest. Are you back in tomorrow or Monday?
I'm on call this weekend. I'm on call. This weekend I'm on call for that section. And next week, by chance, I operate every day. This is how it's going. Some weeks are busy than other. So I got up to Friday, flat out. But then weekend is off. So looking forward to that.
Yeah, good man.
Can I just say thank you to both of you for this evening. It's been a real special sort of nice surprise for me. And to Cesare, thank you very much indeed for what you've done for me. It's changed my life, and I'm eternally grateful to you. Thank you very much indeed.
My pleasure, and thank you, Will. He is organizing that. He's all behind that.
Yeah.
So it's been a pleasure to see you so well. You're strong.
Thank you very much indeed. I'm very, very appreciative of that. Thank you.
No worries.
Bye.
Thanks, guys.
Bye.
Thank you.